staff wanted to learn how to use this because they saw it as important.
So TEC Cymru offered a training support package, but in addition to that, we looked for examples of where it was already being used so that people could learn from their experience.
So the whole idea was all about getting that training out as quick as possible and to as many people as possible as well.
And then we started the task of getting it out to every healthcare setting in Wales.
We provided very intensive support in the early days, but very, very quickly, the local programme teams really picked this up and ran with it.
Creating local ownership and engagement has been absolutely vital to the rollout of the programme.
The implementation wasn't an instruction of here's a thing and here's what you're going to do with it. It was a question or an invitation. Here's a thing, what would you like to do with it?
What we did was start it in a couple of areas first. We then used the digital group to support that and give weekly feedback so people could ask questions, could get loose to the idea, could start to feel, okay, this is what it might look like for my service.
Some health boards very much prioritised services that had been stopped entirely, such as health visiting or therapies, whereas other services, they wanted to target outpatients, their demand was there.
So in Cardiff and Vale at the moment, we have over 119 different waiting rooms that represent various services across the health board.
How that University Health Board is set in a very rural area. For a paediatric team, for example, who were trying to kind of support a patient and their family, they could hold this call with mum and dad or the child, so they were using it from that point of view, so they were stopping the travelling, they could still deliver some element of care.
It's working in some specialities. We never thought it would be in sexual health. In my wildest dream I couldn't imagine sexual health, but they are one of the top on the list. And they've done amazingly well. Podiatry, how could you do something like this in podiatry? So it's just been mind-blowing how people have been creative.
Some of the other things I've really enjoyed is some of the interesting use cases. So, for example, we had our first with a BSL interpreter the other day. A deaf patient actually being able to have a video consultation from home by using an additional participant to sign for them was an amazing use case that we've done.
But the one that's really surprised me is feedback that we've had from people, from users of video consulting, where they're having very difficult conversations about terminal diagnoses. And actually, both the patient and the clinician have been using video consulting and preferring that as a way to actually have those conversations in a much more welcoming, safe environment.